So I'm going to make a start. Kazi, are you and Sheriden ready?
Yes, Joe.
Great. Okay, well it's 4 o'clock now, so I'll make a start and hopefully other people will join us. So a very warm welcome everybody to the Rural Health Seminar Series of 2021. My name's Jo Longman. I'm a researcher based at the University Centre for Rural Health in Lismore. And it's my pleasure to introduce this seminar today. So I'd like to begin by acknowledging the traditional owners of the land on which we're meeting today and to pay my respects to elders past, present and emerging. So a bit of Zoom housekeeping for everyone, please. If you could please keep your microphones muted, that would be appreciated. And I just need to let you know that the seminar is being video and audio recorded today. There will be time for questions at the end of the presentation, so please use the chat function and we'll pick those up at the end of the presentation, or you can try unmuting and asking a question. Just an advert for the next seminar, which is on the 19th of May. So please put that date in your diary. It will be at the same time, so 4 o'clock on Thursday, the 19th of May. And the topic will be Aboriginal health and climate. So there'll be some further information about that seminar coming out to you by email shortly. So it's my great pleasure to introduce to you Kazi, Rahman and Sheriden Keegan, some colleagues of ours, who are talking today about health protection messaging during bushfires. So let me just briefly introduce our speakers today. So Kazi has worked as a public health researcher for a decade, previously at the International Centre for Diarrheal Disease in Bangladesh. He's also worked at the James P. Grant School of Public Health and was a lecturer in epidemiology at Griffith Uni, and he's also worked in education at James Cook University. So welcome, Kazi. Thank you so much for coming today. I'd also like to introduce Sheriden Keegan, who has completed a master's degree in public health at Griffith Uni in 2020. Congratulations, Sheriden, on completing. And is currently conducting research as part of a PhD with Griffith Uni on sustainable and resilient regional food systems. Sheriden has also completed undergraduate degrees in naturopathy and in psychology, and has worked in health science research and teaching at Southern Cross Uni. So a very warm welcome to our speakers today, and thank you so much for coming along to share your work with us. So I'll hand over to you now, Sheriden. Can't hear anything, Kazi or Sheriden. Are you still on mute?
Sorry, now we are.
Like we're having some technical issues.
Yeah, now we are going to present the slides. Just give us 1 second. Can you see the screen now?
No, I can't.
Okay, just 1 second, please.
Oh yes, now we can. Well done. That's it.
Okay. All right, so can everybody hear me okay, can you?
Yes, thank you.
Okay, thanks for tuning in, everyone. My name's Sheriden, and yes, I've been very lucky to be able to collaborate with Kazi on this topic of health protection messaging during bushfires. So just to start off, I would just like to do a brief acknowledgement to country as well, just to acknowledge the traditional owners of this region we live in, the Widjabul people of the Bundjalung Nation and their elders past, present and emerging. As I said, we'll be discussing health messaging to populations that are susceptible to air pollution during landscape fire smoke events. And this was an integrative review that I conducted as part of a larger research project being conducted by Kazi. So I'll be discussing the integrative review that I conducted with his support, and then Kazi will be discussing the field work that he has been working on in collecting more qualitative data in this region. Okay, so as we all know, in 2019-2020, Australia saw unprecedented bushfires across the east coast. So there was 12.6 million hectares of Australia's forests burnt, and 6.8% of the state of New South Wales was actually burnt, resulting in 33 human fatalities, tragically 2,438 houses lost, and a huge amount of wildlife as well. 1.25 billion animals are predicted to have been lost. And so this also exposed us to hazardous levels of smoke pollution in the air. So in Sydney, the hazardous threshold was, air quality reached 12 times that hazardous threshold, and in Canberra, 24 times the hazardous threshold was reached during that time, during those smoke periods. Sorry, just one moment. Okay, so the health impacts of those fires, well, the smoke that is in landscape fires contains particulate matter that is very small, smaller than 2.5 micrometers, and the health impact is that these very small particles lodge deep in the lung tissues and cause irritation, breathing difficulty, and they exacerbate pre-existing respiratory issues. So the recent bushfires, the 2019-2020 bushfires, were estimated to have caused approximately 3,151 excess cardiorespiratory admissions and an excess of 417 deaths. So if we think about the sort of impact that's having, that's quite a considerable amount more than the deaths from the fires themselves. So it's a serious issue. So populations that are susceptible to smoke are people who already suffer from chronic respiratory and cardiac disease, such as people with asthma, emphysema, cystic fibrosis, pregnant women, infants and young children, people that have increased respiratory demands, that need more oxygen and actually breathe more. So elderly people as well who can have reduced lung function and are more likely to have those pre-existing health issues. And also people that have greater social vulnerability are also more susceptible to the smoke. So people in rural areas that are fire prone, people on lower income who are less able to protect themselves with things like air conditioning and people that work outdoors. So yeah, there are certain populations that are more susceptible on a social level. So the research question that was being looked at as part of this review is which health protection messaging pathways and contents are appropriate for informing these susceptible populations during smoke events. And the rationale for this is that Australian bushfire seasons are projected to be becoming longer and more intense. So the recent 2020 bushfires are predicted to become, more of the norm rather than the exception. And so smoke exposure is becoming a more urgent public health concern. How well susceptible populations receive messages about the health impacts of smoke is also poorly understood. And we know that there is very little research out there on this subject. So that's why this research that we were conducting is important. So an integrative review methodology was chosen for this because of the fact that there was not a lot out there, not a lot of information. And so we wanted to bring together as much information as possible to produce a kind of synthesis on the current state of knowledge on this topic. We wanted something that was an exhaustive search strategy, therefore, and that could integrate a broad range of information, quantitative, qualitative, and that would be suitable where there is limited literature. So there was insufficient information to articles to really conduct a systematic review. So we wanted something that was a little bit more nuanced and a bit broader. One of the issues, though, is that this can compromise rigour in terms of the reviewing process. So we implemented a framework that was proposed by Whitmore and Naffel that offers a more structured approach to the data analysis of the review. Just to give you an overview of the methodology quickly, so we did an article search of databases, Ray literature and hand searched. The screening of abstracts and full text followed a Prisma model, and data extraction was conducted using Excel, and then data analysis and synthesis through Excel and tabulation. So the search terms that we used were quite broad because of the fact that we wanted to get all of the articles possible that related to this topic. So we wanted terms related to fire and smoke events. And with those, we also wanted terms related to health protection messaging. And those were put into databases to get peer-reviewed articles. Google and Google Scholar was used primarily for reports, and hand searching of reference lists was also used. In terms of search restrictions, we didn't have a huge amount because we did want to get as much of the articles out there as possible. We did put we only wanted articles that were 10 years old, so 2010 onwards. We wanted articles in English or with English translation from any country. And we wanted peer-reviewed scholarly articles and reports, but we didn't want any magazine or newspaper articles or book chapters. They were the only formats that we didn't look at. The population was for the general population in terms of the search for articles. We found that narrowing the search to susceptible populations was a bit too restrictive, that we were missing useful information, so we broadened it out to just the general population. Articles were selected that specifically address landscape fire, though. So because landscape fire has specific toxins and health impacts, we didn't want that mixed with general causes of air pollution, such as traffic pollution. So anything that was not landscape fire related smoke, air pollution was excluded. And this was also because there are also situational and psychosocial differences to health messaging during a smoke event to just health messaging during everyday pollution situations. So the article selection process was based on the Prisma model, and we retrieved a total of 177 articles. Sorry, we retrieved 26 articles to include in the review. Most of the articles that were excluded due to being insufficiently related to landscape fire smoke or not sufficiently related to health protection messaging. Many were also excluded that related to other forms of smoke, such as tobacco or wood fire heaters, for instance. The thematic analysis of the data that we followed. So we basically were looking at three broad groups: the health protection message content, the health protection message delivery, and also we wanted to look at other relevant themes on susceptible populations, themes that were relevant to susceptible populations. And then within those three broad categories, we looked at, well, what are the key themes that are coming out of that? So through data reduction, we looked at what are the key themes that are within these three groups. So within health, the content related to message content was the message recall and compliance, message consistency, and targeted messaging. Within message delivery, the key themes were channels of communication, trust of source and timing, and within other things relevant to susceptible populations was advanced planning and preparation for bushfire seasons, compounding issues, and interagency collaboration. And so across those categories, we also compared the methodologies used, so whether they were quantitative, qualitative, and appraisal of the article's quality as well, so both within those sub-themes and across the board. So findings on message content that related to message recall, compliance, and appropriateness. So the key findings were that under emergency conditions, short, clear, non-technical messages are recalled and complied with better. Persons that are greater than 75 years of age are less likely to receive those messages. So they're a key group that need to be watched out for during emergency conditions. But there is also this dichotomy that residents of fire-prone communities wanted more detailed information. So during emergency conditions, they sort of want short messages, but there's this underlying need for more information. So they wanted to know how to protect their health and what are the health impacts of the smoke. And yeah, this was found across both qualitative and quantitative articles. So another key thing coming out of the message content is the smartphone apps for health protection during smoke events is a really emerging theme. Like it's becoming a much more common practice of communication. And so app users are engaging with and acting upon health protection information. In Australia and the US, there are both apps available where people can get information on how to protect their health during smoke events and air quality information. In the US, the Smoke Sense app, they found that 89% of users were taking action to protect their health. And those actions increased according to the severity of their symptoms. So people that had more severe symptoms took greater steps towards protecting their health and tended to do more. In Australia, the information received from the Air Radar app, which was developed down in Tasmania, they found that the app directly influenced 30% of users to take action to protect their health. So the difference between those is that the Australian users, the app was directly influencing their actions to take protection for their health, whereas the US one, they didn't specifically ask, was it the app that was prompting you to take action to protect your health? With both of these studies, these are really emerging evidence. There are methodological issues in the sense that both of these studies involve self-selection bias. So it's only people who are choosing to engage with the app that were being assessed and investigated. So people that don't use the app, and whether or not those people out there, if they were suggested to use the app, we don't know anything at this point about how they would interact with app information. So on message content, we also looked at consistency of messaging and targeted messaging. So inconsistent messaging was also identified as a key issue to message acceptability. So inconsistent messaging leads to confusion and lack of confidence in the health agencies and the sources of those health messages. This is particularly a problem in regard to air quality indices. So people finding that they would get one reading from one source and one reading from another source, and so people would not know who to believe. So there needs to be an improvement in interagency collaboration and communication on this issue to align messages, and targeted messaging to specific communities and populations was also identified as a key theme in the literature. So modelling studies indicated that the most fire-prone communities in the US also have higher social and health vulnerabilities as well. So this might be an area where more targeted health messaging could be appropriate. So increasing the personal relevance of messages while using smartphone apps was also seen as found in the research. So you can, using the apps really provide an avenue to collect information on people and their personal data, and then, you know, target the information that is going to be most relevant to them. Ensuring message relevance to specific subpopulations was also flagged by stakeholders, particularly. So they said that the stay indoors messages, for instance, to outdoor workers or homeless people is really not relevant or appropriate. So there needs to be sort of more targeted information going out to these specific subpopulations. In relation to health protection message delivery, probably the key theme that was being discussed in the literature was the channels of communication. So which channel is the most effective? So what we're seeing is that communication channels that are effective tend to be place and population specific. So older and rural persons are more likely to source information through traditional communication channels such as television, road signs, local radio or newspaper. For prescribed burns, people really appreciate mail or phone call, personal means of communication. Telephone and internet reception is seen as a bit of an issue in rural and remote areas, that it's not reliable. Even though people do use it, it's not seen as the most reliable method of communication. Direct lines of communication are still very important in rural areas, particularly remote areas for susceptible populations, so healthcare providers, for instance, emergency workers. Younger and urban populations were much more likely to use smartphone and online channels along with television. So television across the board is kind of seen as reaching the general population quite well. However, a lot of this information was based on studies that are becoming quite dated now. So the way that we communicate is really changing, evolving quite quickly. And so I think that, much more research is needed on what's currently happening in the communication sphere and how people are using these channels of communication, because I think it can actually be changing. So the trust and timing of messages was also looked at, was also key themes in message delivery. So the source of the information, it's important that there is a high level of trust. And in Australia and America and Canada, evidence suggests that there is a high level of trust in health authorities. However, that can be eroded by perceived or real negligence, inconsistent message content, poor timing, and exaggerations in messaging. So for instance, in Australia, for prescribed burns, sometimes people would get messages that there was going to be a burn, sometimes they wouldn't. And that would lead to people not really thinking that they were capable, the health agencies, there was a lack of capacity perhaps, or a lack of care. But people really appreciated that consistency to be able to take the necessary measures to protect their health. So the timing of messages was also important. So susceptible populations receiving health alerts at a lower threshold of air pollution was found to produce better health and economic benefits. And also in more recent years, real-time air quality updates has been flagged by experts in the field as necessary, as this would allow people to plan their daily activities where smoke levels are lower. So this is particularly relevant where there's prolonged smoke. So when smoke's going on for days and weeks at a time, people can't just stop their daily activities indefinitely. So knowing when smoke levels are going to be at their lowest is really going to be helpful for people to plan their days to have the least exposure. So additional themes relevant to susceptible populations. The key theme that was observed, not necessarily as studies themselves, but mentioned across a wide range of literature by experts, stakeholders, there was flagged that there's a need for better preparation and planning around bushfire seasons. So there's need for information campaigning, particularly that technical information that is difficult to take in during an emergency. So the use of personal air cleaners, the use of respirator masks, these kinds of things. It's also important for people to be able to make a health protection plan with their healthcare providers to get their medications in order, for instance. Building interagency relationships to be able to produce more consistent information, and preparing community spaces with proper air filtration and information. So places particularly nursing homes, preschools, schools, where there's likely to be more susceptible people. So giving susceptible populations time to be better informed and take the necessary measures to protect their health was a key reason for this preparation and planning. So getting their equipment, getting their medication, and having time to absorb that information. Another key issue that was identified in the literature was there are strategies needed to address compounding health threats. So when there's a smoke event and a heat wave concurrently, what do we do then? So giving people a stay indoor message, if people do not have air conditioning, it's what is going to be the worst health outcome for them, the heat exposure or the smoke. If you're telling people to stay indoors when there's an indoor source of air pollution such as tobacco, which is, are they going to be at greater risk due to the indoor air pollution? Are they better having more ventilation with windows open? So these are the kinds of questions that need to be tackled and need to form part of the messaging so people have guidance on what to do. In addition to that, prolonged indoor confinement also can lead to lack of exercise, poor mental health and well-being. And these things also need to be addressed in messaging people as well. So looking at the research gaps, so the things that really stand out that need to be addressed are how best to deliver relevant technical information. So the use of air conditioners on reverse cycle, air filters, which are, you need to have the right type of filter for the space of the room. So things like that information needs to get out to people. The use of smartphone apps it's a really, a big area for development. There's no representative data as yet on how people are interacting with apps, and particularly given how much people were interacting with the Fires Near Me app in the recent bushfire season. It's interesting to see what could happen in the future in terms of providing health protection messaging regarding smoke through that sort of platform. So yeah, there's also more research needed to quantify preferences for an actual use of communication channels in susceptible populations. So much of the research data is quite dated, as I said, and this is in a world that is rapidly changing in the types of communication. People are interacting with smartphones much more now, so we really need up-to-date information on that. Another issue is the lack of health data on the impact of landscape fire smoke. So one of the things that stakeholders in interviews talked about a lot was that it's very challenging providing accurate messaging to people. People want information about how it's going to affect their health, but health agencies don't necessarily have that information to give. So we really need to fill those knowledge gaps on how smoke impacts on the health. And also the increasing duration of smoke events is, how do we adapt our messaging content and delivery to be more appropriate for these longer lasting smoke events. So there's the references that were used in this one, and We also have recently had a publication come out on this topic, Kazi and I. So if you feel like doing a bit of further reading on this one, you can check out the article. And I'll hand over now to Kazi, who I have been very fortunate to have the opportunity to work with on this, and has been working very diligently on out in the field gaining information. So I'll pass you over to Kazi now.
Thank you, Sheriden. And while Sheriden was doing her review, we decided to go to the people and talk to them. And we planned for a very small scale exploratory research. And by just looking at the list of the affiliating institution and the authors, you can see that it was a very fruitful collaboration between us from North Coast Public Health Unit, New South Wales Health, and also other departments within the Northern New South Wales Local Health District, including Integrated Care and Allied Health Services and Health Promotion, and also with University Center for Rural Health. And in this exploratory research, we focused on health protection messaging for people living with chronic conditions susceptible to air pollution during bushfires in Northern New South Wales. And at the beginning, I would say that we are still collecting data since we started, COVID started. So we were doing focus groups with respiratory patients attending rehab clinics. So we had to postpone that because those rehab sessions were postponed. So we are hoping to continue data collection this year as well. But the data that we received, we thought that we should share those findings before the next bushfire season starts, because we came up with some interesting results. And in this slide, you can see the Fires Near Me app snapshot that was taken on the 12th of November 2019. And it tells us how much fires were burning at that time with different intensities. And in our exploratory research, we decided to explore patients and providers' perceptions on the delivery and effectiveness of health protection messages in relation to air pollution during bushfires in our region in Northern New South Wales. And we conducted focus group discussion involving chronic respiratory condition patients attending rehabilitation programs in Northern New South Wales, and then in-depth interview of providers and in-depth interview of senior managers from public health and local council. And everybody agreed that yes, lots of smoke were there everywhere. And there was smoke probably for weeks. And like the fire happened from different directions. So the smoke was quite intense. And in fact, the smoke started burning, the fire started burning from September. And that's why I think recently that last year, the fire season actually started from September. Usually it starts in October in this area. And we all know this sun, and it was there for weeks, for days and weeks. And I took this photo on the 9th of November, 2019, and it was quite oppressive. It was magic. It was stressful. So these are all quotes from the participants of our exploratory research and from the patients. And when we asked them about the experience and response of the patients, firstly, they were all susceptible to air pollution. They were all patients having respiratory conditions. And they noted that, they reported that some experienced worsening of their respiratory conditions. And sometimes the conditions deteriorated at night time. And some had exacerbations and they had to get medication. And they said that they use common sense to handle these circumstances, and they tried to stay inside, but still it was not helpful because it was kind of non-stop. They couldn't even open the windows. And one thing is that these patients, they are most educated about respiratory health because they're attending the rehab facilities, they have respiratory conditions, so they know about what to do. Now, they mentioned one more thing, and that is that they didn't try going outdoors for doing any exercise during these smoke conditions. That was very good. Now, when we talked about immediate health warnings, like the health messaging around air pollution during the acute phase of the bushfire, they mentioned that during that acute phase, it was more focusing on the immediate physical and personal safety and fighting the fire, and immediate warnings about physical harm from direct exposure to fire. And they were warned of possible road closures and advised evacuation, which was very, very practical and which was very much needed. And there wasn't much on the health protection from air pollution. And when we talked about access to tools, medications, and care, they had the participating patients had difficulty in operating tools, like there was power failure, the CPAP machine didn't work. And at some point, some participants decided to take shelter in the community clinics. And it was great to know from the provider that we were interviewing from the rehab program that the number of participants attending the rehab clinics did not drop during that bushfire and smoke event timing. People kept attending. All of them had chronic lung disease, but they kept attending, and the venue was good, and like they felt safe coming there. And there was a good advice from one of the participants that next time that participant will make sure that next time he or she will have enough medications and things like that. And they will try to prepare beforehand, even before the bushfire season starts. Now, when we talked about air pollution and health protection messaging, everybody mentioned about television. Although many lost television coverage and lost mobile network because of burning out of the towers. So they didn't have TV, and they couldn't access to those warnings, but people used radio, which was great. And the other thing that Sheriden mentioned, and we also found, was that the app Fires Near Me, everybody was using that. Everybody knew that there was an app called Fires Near Me. And someone mentioned that it was that popular that half of the time, it took bloody half an hour to download anything because every man and his dog was on there. And they suggested adding a big ad in the paper, which are like free papers. And of course, if something could be added to Fires Near Me. Now, when we spoke with managers, one thing that we realized is that it was a kind of multi-agency task during that acute phase of fire. And some people were very much attached to the ground, very much attached to the immediate needs, and some were at the more distant level, but they were all worked as a team, and it wasn't that easy making that coordination during that acute phase, and different agencies played different roles. And the managers, they said that the simplicity and consistency of messaging is very important, and Sheriden also highlighted that in her review in terms of consistency of messaging. And at some point, when the Linfield Park Fire was burning for months, the messaging needed to be tailored to some extent because that long-standing fire and smoke would also affect pregnant women. So the messaging changed to some extent, but otherwise they tried to come up with messages which are short, which are simple, and which are based on facts. But the problem that the managers faced at that point was that they could not tailor the messages based on the current air quality. And it happened because there was no air quality monitoring that were permanent at that time, other than setting up temporary air quality monitoring pods to the fires next to the fires, but they were not everywhere. And it's easy to say it's common sense if there is smoke around, but the managers, they needed to also come up with some standards, some guidelines. That was difficult without having any real-time air quality monitoring. Now, the good news is that now, it wasn't there at the time during the 2019 fire, but now there are 2 permanent rural NSW air quality monitoring systems placed in Lismore and Grafton, which is a good news, although it has got some limitations, like it depends very much on wind direction. It doesn't provide air quality index. It just provides the measurements, which cannot be interpreted by general public. Now, in terms of ways of sharing messages, word of mouth was used. Managers suggested using word of mouth, SMS, radio, printed messages, health alerts, or media releases, social media. Northern New South Wales Local Health District has the Facebook post page that can be used, and also the internet, the web pages, and also the existing networks. For other ongoing programs, there are already established networks that could be used. And the managers highlighted that there is a difference in terms of managing fires in rural and remote settings, and that in metropolitan and urban settings. And of course, there are certain people who fall through the crack. There are groups, and the messages need to be tailored to address their literacy levels. And this is an opportunity where we could also involve, like we involved in our research, the health promotion team, especially the health literacy team. So people with those expertise should be involved in health protection messaging. And also there are standalone communities, and we need to be mindful about them, and we need to make sure that we get into those communities as we can and do the right things. Providers describe the need for easily and accessible messages with explanations that Sheriden also mentioned in her review, that people want to understand why they need to do this. And we do that for coronavirus. One of the respondents said that. One of the providers said that we do that for coronavirus. We are trying to explain to people what is the virus, how is it transmitted, and why we need to do this. And we need to do the same for bushfires. Like, we need to explain people, and then we need to advise them for doing something. And there is a need for simple information sheet that the providers can use for patient education. We looked at the health pathways, and it is good that we found that under COPD, they have added information on bushfires and health protection. But the problem with this is that when you click on that link, it will take you to another website. And then you need to have a reading of all the information there, and then you need to come up with your own information. But it would be handy if there could be something that is like a one page and that comes up instead of directing the providers to another website. And health pathway that doesn't have this kind of information under all the respiratory conditions. It was under COPD, but it may not be under asthma or other sections. So we found that participants reported that there was little tailored health protection messaging on air pollution during the acute fire, and people struggled with accessing necessary tools and medications to keep themselves safe from smoke. And people could access radio, that was good. Mobile network and TV signals were interrupted. And intervention with health protection messaging during the acute phase of fire was essential, especially for those who are vulnerable. And the Fires Near Me app was widely used and could be used to convey those messages. And people vulnerable to air pollution should also be advised to prepare themselves for bushfire before the bushfire season starts, that we can actually start working in near future. And future large-scale translation research are of course needed. and evaluation of the above mentioned proposed interventions is warranted. This is my most favorite slide of this presentation, where one of the respondents say that, so now you can go back to your bosses now, play your recording, and they can become wiser and more wonderful. And the snapshot from the Fires Near Me app taken on the 14th of February 2020 was a very rare but long-awaited moment when there was no fire in this region after months of fire burning here. So I would like to thank you for your patient hearing, and we'll be happy to take questions. And I know that there are many resourceful persons in the audience, so we'd like to hear from each of us. So I'm going to stop my screen sharing, and I'd like to hand it over to Joe. Thanks. And also I'd like to thank UCRH, as Sheriden mentioned, that inviting us to give this presentation. And also I'd like to thank other providers and who helped us in terms of giving access to patients, in terms of helping us with data collection, without which we wouldn't be able to do this research. They may not be mentioned in the authors list, but they were there. Thank you.
Wonderful. Thank you so much, Kazi and Sheriden. So we'll open it up to questions now. There's only, it looks like there's 21 of us online right now. So if you want to unmute and ask a question, I'm sure that's manageable, or feel free to write a question in the chat.
Hi Joe, Ross here. I'm happy to kick off just to get the ball rolling. Thanks for that presentation. That was really interesting, and I was particularly interested in what you talked about in terms of tailoring the message, but also the delivery of messages to particular groups, and particularly the need to do better in relation to vulnerable populations or culturally and linguistically diverse groups or people living with disability. And I'm just interested in your sense of how we're doing in terms of getting better in that area. I think we recognise there's a real need there, but are we making progress in that space? And what are new developments that you're seeing in terms of those improvements?
Well, I think one of the things that came out of the literature for me on this sort of topic was the need for that interagency collaboration, to be able to health agencies talking with sort of peak body organisations for those vulnerable groups, or talking, with people involved with those vulnerable groups, and finding out, through that communication and collaboration with local groups what's needed.
And also when we were discussing with the managers, we asked them whether they knew whether people are receiving their messages and whether they're responding to them. So it is very difficult to tell from the supply side, unless people are visiting emergency department more. We cannot tell exactly whether people are actually suffering more from air pollution. So yeah, this is an interesting aspect where, as Sheriden mentioned, that we need to have more collaborative discussions, and also we need to go back to the people more to understand their understanding and their view. And I know that there are other there are other resourceful persons among the audience. Paul Corbin, our Director of Public Health, is also there. And also Neil Heim is there. He's the Senior Policy Analyst. So anyone feel free to share share your comments in this regard as well.
So my sense from your answers is that there's recognition and people are starting to talk about it and consult about it. but I'm not hearing about any sort of practical action yet. And if you were to, based on what you know, if there was some immediately achievable practical actions, things that we could be doing better that are relatively straightforward, what do you think those would be?
I think the first thing that is needed to be done, like we are just presenting the findings, but we need to have more discussions with all the stakeholders, and we need to go back to the people with these findings and share our findings and have a discussion with them. We haven't done that discussion part yet. We're just presenting the findings. So there are more to do before we plan for developing more messaging, targeted messaging that will address the need of the people.
I think on a local level, like probably mapping the vulnerable community groups or even individuals on a local level with people that are on the ground could be really beneficial too. I know that that's one of the things in some of the reports, the interviews that people were talking about is having that increased communication between groups allowed them to sort of identify, even if it's just a sort of mind map of the area about who this person's there and there's this group here, and like creating those sort of maps of community and where the attention needs to go when the smoke gets bad or any emergency arises, really.
You have a few questions in the chat now. So Tim's asking, any thoughts on how we deal with stoic rural town populations?
So what was the question?
Any thoughts on how we deal with stoic rural town populations?
Okay. It's a very difficult question to answer. And again, here the issues around context comes, and we need to be in touch with them. Like what we are presenting here, we are presenting the viewpoints of patients attending rehabilitation clinics, and they are the vulnerable group, but we haven't been to the community yet. So of course, there are more explorations needed in terms of addressing the stoic rural town population, because we know that these areas are has got a diverse population, and we need to be in touch with them.
Yeah, one of the things that I really liked in the smartphone app studies that I looked at was that they're starting to look at these sort of profiles of people interacting with the apps, and people, so for instance, people that had a good deal of knowledge that didn't want more information but just wanted to know when to act. They could be targeted with a certain type of information, and then people who needed more knowledge and needed a bit more support could be targeted in a different way. So those apps, I think there's a lot of opportunity for development there of giving the people the information they want, not just a very generic type of information. And I think for people in rural areas that already have a lot of information about things, like that more targeted type of information delivery could be better.
Okay, you have another few questions, so we'll move on. There's a question, was there much thought given to psychological impact of messaging? Some Aboriginal elders in Nambucca Valley were terrified due to how they understood the messaging.
Yeah, that's a very important aspect that we need to address. And again, as I mentioned, that our research focus on just patients attending the rehab clinics, and they come from all walks of life, but we need to go to the communities. And also we might want to focus more on the Aboriginal people that we haven't done in our research, but of course we need to explore that in future and in other research investigations.
And maybe there needs to be a bit more scope for that kind of more personal messaging, like those direct lines of communication, such as, if there's a health worker that can take these messages rather than just receiving a very generic message and That way, you know, there's a personal contact, might be a bit more, finds a more acceptable way of giving the message.
Yep. There's a question or a comment really that nothing was mentioned about blackouts that lasted for days. Community members on CPAP were cut off by the fires.
Yeah, it also came out from our interviews, and a patient mentioned that that patient couldn't use the CPAP machines because of the blackout. And although the patient at the end said that it was okay, he could manage it, but he had that problem. And this is an issue. Like we rely on electricity a lot, and it's not only CPAP, but it's about the internet use, it's about television, it's about everything. We get disconnected with everything, and this is where we need to be prepared beforehand. Especially if we need to rely on certain tools and medications, we need to prepare beforehand.
And not rely on any single method of any single channel of delivering messages. So have a broad range of delivery methods, so that, you know, if certain ways of communicating get cut off, there is other methods that you can get the message out there.
Okay, I think we have time for perhaps one last question. I don't know if anybody is.
It's Neil Heim here. Could I ask a question? Hello.
Sure. Hi.
Hi, Kazi and Sheriden.
Hi.
Thank you so much. I really enjoyed those presentations. And sorry, I don't have my video on, so you can't see me. Do you feel that people are receptive to wanting to receive some information prior to bushfire season in advance? And can you also talk to during these pretty extreme events, if we try to get some messaging out about smoke, is it drowned out by what are perceived as more immediate threats, like whether people should evacuate, leave their home and things because of the actual fire? So I guess what I'm trying to ask, do you think there's a place for trying to increase people's awareness of the impacts of smoke outside of the time of the emergency? Does that make a bit of sense?
Yeah.
Perhaps you could just talk to that.
Yeah, look, I mean, I think there's a real scope for looking at, you know, places that susceptible populations are likely to seek information, such as, you know, doctors, pharmacists, you know, people with asthma. You know, if someone's coming in to get their medication, that's a really good opportunity to, you know, say, hey, have you got a plan for, you know, bushfire season in terms of smoke? And, you know, that could be a good avenue to provide that information. It's something that was mentioned in some of the interviews, in reports that I read, that particularly pharmacists are probably being underexploited, and there needs to be sort of a more consistent way of distributing that information. And I think, you know, healthcare providers for susceptible populations is a really key avenue. Yeah.
Yeah. Thanks, Neil. And as Sheriden mentioned that, like I was telling my colleague this afternoon, that we are now so busy with COVID, and then we just had floods. So we are talking about bushfire, whether it is a good timing, but it is not far. The bushfire season is going to start. So it might feel a bit irrelevant at this moment, but it is not actually. And it can become difficult to make or to communicate with everyone in regards to bushfire at this moment, but we can target those who are vulnerable. They will know that they need to start preparing for that. And also during the immediate acute phase of fire, instead of targeting everyone, we can target those who are vulnerable. Yes. And we can help them prepare beforehand, because they will suffer.
Yeah, great, thank you.
Thank you.
Wonderful. Okay, we've got 1 minute left. I'll squeeze in this very last question. And there are a couple of comments actually that you might want to see in the chat. So I'll copy that and send it to you, so you've got a copy of what people wrote in the chat. So somebody said the confusion between the emergency services was an issue in our rural community. We were referred to APS, and without power and the solar panels due to smoke unable to power up and no mobile devices, only radio, and they got overwhelmed by calls.
Yeah, that also was reflected in our interviews. Yeah, thank you.
Okay, well, I think we'll have to close the meeting now, the seminar. Thank you again so much, Kazi and Sheriden, for coming along today and presenting your work. It's fantastic and really important, interesting work. So thanks very much for coming along, showing, and thanks everybody for coming along today and taking part. And don't forget our next presentation, our next seminar will be on May the 19th. Thanks very much, everyone.
Thank you everyone.
Thanks for inviting us.
Thanks, Joe. Bye.
Bye.